kids are with a babysitter, and wow, this is exciting. My, how we changed. I've been a physician for about 30 years, almost 30 years, and I've been a radiologist for about 20 years, and doing a lot of mammography, a lot of breast imaging during that time. And this is a very exciting time in breast imaging. There's breast MRI, there's ultrasound, which has just gotten so good, and then there is digital mammography, and there are some other techniques as well. And so we are able to diagnose or see breast cancer at earlier stages, which allows women to be treated earlier and hopefully with better results. But as a radiologist, I see a lot of women every day, actually. I was at the breast center yesterday, and I worked there a couple days a week, just right down the street here. And probably yesterday I read maybe 100 screening mammograms and probably 12 or 15 diagnostic mammograms. Different people did 3 biopsies on 3 different women. And there's just a lot going on. And at some point, the diagnosis, doing the biopsies, doing the diagnosis is one thing, but I spend a lot of time talking to women as well, women that have recently been diagnosed, and I'm either doing some follow-up study on them, or women that I'm telling that, hey, you've got a suspicious finding. And there are always the questions and always the concerns, and it may be about themselves. What can I do to prevent this? What can I do to make sure my daughter or my sister, doesn't get breast cancer and that sort of thing? And for a lot of years, there are the standard, risk factors that we can tell people, but a lot of that is not really within their control. And this brings me to the point why I'm here tonight, and that's that I had heard about Dr. Kallenborn's work several years ago, and I kind of put it into my brain vault and thought about it a little bit, and then every once in a while, looked into it a little bit further, went online, talked to people, and that sort of thing to try to get more information. And one of the things that I started noticing and wanted to look into a little bit further is basically every woman that comes in and gets a mammogram fills out a little information sheet. And on that information sheet, there are a lot of different things. And this is kind of what it looks like. But one of the things I really started to notice, I started looking at the age at first use of hormonal contraceptives, the duration of use, and the age at last use, and whether or not they were currently using it. And virtually every one of the people that I have dealt with over the last few years when I've started looking at this, most of them, the vast majority of them, all had used oral contraceptives for at least several years prior to their first pregnancy. And so, there's a lot of oral contraceptive use out there anyway. So is that significant? Is it not significant? But I would say, and there are definitely exceptions. There's a dear friend of mine that has a recent diagnosis, and she was definitely an exception. But it did look fairly compelling to me. And anybody here can go online. Any physician can go online, and I do that every once in a while. And I did that this week just in preparation to see, well, what's out there? What's new and exciting about this potential information that might be helpful to people. And I went to the medical journal Slate. Now, I don't know if any of you know Slate. That's something that's it's a fairly left-leaning website. My brothers who live in California, they all read Slate, and it's gospel to them. But I just wanted to read something from Slate, and again, it's fairly leftward. The pill breast cancer connection, does it exist? And this was from September 17th, 2010. Last summer, in a study of more than 50,000 African American women, Boston University epidemiologist Lynn Rosenberg found a 65% increase in a particularly aggressive form of breast cancer among those who had ever taken the birth control pill. The risk doubles for those who had used the contraceptive within the past 5 years and had taken it for longer than 10 years. This unwelcome news doesn't fit well into the wave of coverage of the pill's 50th anniversary. A Newsweek columnist gushed that the pill did more good for more people than any other invention of the 20th century. In a cover story on Time magazine, they extolled the pill as the means by which women untied their aprons, scooped up their ambitions, and marched eagerly into a new age. And actually, the lady that writes this, Florence Williams, she said, "True, thanks, pill." A commemorative MSN.com piece flatly asserted earlier this year that taking the pill has no impact on breast cancer risk. Rosenberg's findings question that assertion. She wanted to study black women because they have been underrepresented in cancer research so far, even though they suffer from higher rates of triple-negative breast cancer. This relatively rare form of breast cancer, in which the tumors lack certain genes and so are not responsive to standard treatments like tamoxifen, confers the highest and fastest mortality. In Rosenberg's work, it was these that were linked to the pill. A number of other studies of women of multiple races support her data implicating the pill in breast cancer, including research done in New England, South Carolina, Long Island, New York, and Scandinavia. And this is coming from Slate, okay? And in terms of actually looking at those studies, I quickly did a review this week, and I've done this over the years, but I noticed that this summer has been especially interesting in terms of the fact that there is a lot more information out there, although it doesn't seem necessarily to be getting out to people. And if anybody is interested afterwards, I do have that article that was done at Boston University on the African American women. And it's a very good study. And I also wanted to go, okay, the people that tell us about cancer, people like the American Cancer Society, Centers for Disease Control, the National Institute of Health, what are they saying? If I was a person of good intent, no matter what side of the issue I fell on, can I go to these sites? Can I go to these websites and find out some information about oral contraceptives and breast cancer? You can go to the American Cancer Society site and you can get the different causes, the risk factors that Dr. Kallenborn has talked about. One of the things that they do mention, breast cancer risk and lifestyle choices, one of their risk factors that they do list on the American Cancer Society is recent use of birth control pills. And they talk about the different information. And then they say it's a good idea to talk to your doctor about the risk and benefits of the birth control pills. And they also talk about hormonal replacement therapy after menopause, and the use of combined hormonal replacement therapy after menopause increases the risk of getting breast cancer. And they also increases the risk of dying from breast cancer, so mortality is increased. So it is out there on that site. The other site that anybody can go to is the National Institute of Health, National Cancer Institute, and on their opening webpage, how do oral contraceptives affect breast cancer? First of all, they say that the risk of breast and cervical cancers is increased. A woman's risk of developing breast cancer depends on several factors, some of which are related to her natural hormones. Hormonal factors that increase the risk of breast cancer include conditions that may allow high levels of hormones to persist for long periods of time, such as beginning menstruation at an early age, before the age of 12, experiencing menopause at a late age after 55, having a first child after 30, and not having any children at all. And then the study that Dr. Kallenborn talked about, in a National Cancer Institute-sponsored study published in 2003, researchers examined risk factors for breast cancer among women ages 20 to 34 compared with women ages 35 to 54. Women diagnosed with breast cancer were asked whether they had used oral contraceptives for more than 5 months before diagnosis, and if so, whether the most recent use had been within 5 years, 5 to 10 years, or more than 10 years. The results indicated that the risk was highest for women who used oral contraceptives within 5 years prior to diagnosis, particularly in the younger group. There's just this implicit acknowledgement that oral contraceptives do increase the risk of breast cancer. And there are different ways that these institutions talk about that risk, but it's implicit in everything that they do and that they write. And I have several other articles, and I will try. I'm not going to go into the details on these, but anybody who's interested, I can show them to you afterwards. One article entitled "Estrogen plus Progestin and Breast Cancer Incidence and Mortality in Postmenopausal Women." The conclusion is that estrogen plus progestin was associated with greater breast cancer incidence, and the cancers are more commonly node positive. Okay, that means that it's already spread to your lymph nodes. Okay, so metastatic disease. Breast cancer mortality also appears to be increased with combined use of estrogen plus progestin. And that was recently published in the Journal of the American Medical Association, in JAMA. And that was the Women's Health Initiative study. There's a study from France that's recent as well. And basically they said in a previous study we found a positive association between premenopausal use of progestogens and breast cancer risk. They looked at 67,057 women and found an increased risk of lobular carcinoma associated with premenopausal use of progestogens among both current and past past users, with a hazard ratio of 1.51, so a 51% increase. Among current users, the use of progestogens for 4.5 years or more was associated with an increased risk of estrogen receptor positive and progesterone receptor positive carcinomas, whereas current use of progestogens for less than 4.5 years was associated with an increase in the estrogen receptor positive, progesterone receptor negative carcinoma risk. So again, they found a definite increased risk for lobular carcinoma, which is one of the breast cancer types. I've got other studies, at least 6 or 7 studies. There was a big study, the Norwegian-Swedish Women's Lifestyle and Health Cohort Study, with basically the same current or recent use of oral contraceptives associated with an increased risk of breast cancer. Use of combined oral contraceptives and progestin-only pills seem to increase the risk at the same level. So, to me, as somebody was initially looking at this from kind of a neutral standpoint, just trying to figure out, okay, what do I say to these patients who are asking me about risk factors, and what they can do for themselves, what they can do for their family members. This is something that I definitely talk about now, that this is an issue, and it's something that people can control. So I think there are a lot of reasons why the information hasn't gotten out, and most of us can probably guess, and I'm not going to go into all those different reasons, but I do think that it's part of our jobs as physicians and as people that maybe work in the healthcare field to try to make sure that this information gets out.